let's talk about a total game changer for healthcare. It's a new kind of AI called Agentic AI. And trust me, it's not just another tool for getting information. This is about an AI that actually does things. And it could soon become your personal health co-pilot.
I mean, think about it. The AI we're used to, it's pretty good at answering questions, right? But what if it could actually take the next step? Not just give you advice, but then go ahead and book the right appointment for you, or figure out your insurance maze, or find that specialist you need.
Well, that's the jump we're talking about with Agentic AI. This is not some passive chatbot waiting for you to type something. It's designed to perceive what's going on, make a plan, and then actually act on it. It's not just an advisor anymore, it's an active participant. So let's dive in and really unpack what it means to have an AI that does more. And we're not talking about small tweaks here. This is a fundamental shift in how we're all going to interact with the healthcare system. Okay, so here's the simplest way to think about it. Traditional AI is reactive. It's like a super smart encyclopedia. You ask, it tells. Agentic AI is proactive. It doesn't just see you have a fever, it asks if you want it to find and schedule the next available telehealth slot. It's a partner, not just a predictor. So how does this all work behind the scenes? Well, you can kind of break it down into three simple layers. You've got the big idea, Agentic AI itself. Then you have the agents. These are the individual software programs that are the actual actors doing the work. And they operate inside specific workflows, which are just the real-world situations they're built to handle. All right, enough theory. To really get a feel for this, let's follow a patient's journey. We'll start right from their home and go all the way through the hospital system, seeing exactly how these agents can turn a really stressful process into something, well, something that just works. You know this feeling. We've all been there. You feel sick, your symptoms are weirdly confusing, you have no idea what kind of doctor to even call, and then there's that looming dread about your insurance. It's what we call the front door problem in healthcare, and honestly, it's a mess. Now imagine this instead. A patient-facing agent helps you make sense of your symptoms. A different agent scans for the right doctor and books a perfect appointment time. And another one translates your insurance benefits into plain English. Just like that, the messy front door problem is gone. It's a clear, guided path. Okay, so our patient made it through the door. But their journey is far from over, because once you're inside the hospital, a whole new level of complexity kicks in. And Agentic AI is there to help too, not just for the patient, but for the doctors and nurses. This image really says it all. Getting care inside a hospital is like trying to navigate a massive, complicated map with a million different paths. These AI agents, they're like the expert guides who know every single shortcut and landmark to get you where you need to go. And one of the biggest problems on that map is clinician burnout. Seriously, our doctors and nurses are drowning in paperwork and admin tasks. All that time spent on a keyboard is time they can't spend with their patients. So in comes a clinical agent. Think of it as the ultimate scribe. It can help structure and fill out all those clinical notes, drastically cutting down on typing time. This is huge because it frees up clinicians to actually talk to their patients face to face, which is the whole reason they got into medicine in the first place. And the help doesn't stop with the clinical side. You've got operational agents tackling the hospital's logistics. Take a transport agent, for example. It's a simple idea. It just coordinates getting a patient from their room to, say, an MRI scan. But by optimizing that one thing, it cuts down wait times, prevents logjams, and makes the entire hospital run better for everyone. Okay, so now let's pull back the curtain and look at the part of healthcare we almost never see, but that makes everything else run, the incredibly complex world of administration and finance. Yeah, this is the hospital's invisible engine room. Administrative agents are designed to automate all that gnarly billing, coding, and back and forth with insurance companies. It's essential work, but when it goes wrong, it's a huge headache for everybody. And check this out, a denial management agent. It does more than just fight to get a single wrongly denied claim paid. It actually spots patterns. It figures out why claims are getting rejected and helps the hospital fix the root cause. That saves money and strengthens the whole financial system. So when you start connecting all these dots, the patient guides, the clinical assistants, the background operational agents, you realize you're not just fixing individual problems, you're actually building a brand new, intelligent ecosystem for healthcare. At the end of the day, this isn't about just automating a few tasks. The real goal is to create one seamless system, a system where information flows where it needs to, where care is proactive, and where both patients and doctors feel supported every single step of the way. And all of this leaves us with a really big question to think about. As AI stops being just a tool and starts becoming an active participant in our health, what does that mean for us? What new questions should we be asking about trust, about privacy, and about the human side of medicine? These are the conversations we need to be having right now.